So this is because of the importance of sampling of contralateral lobe. So it's because there is a current recommendations in new guidelines that you need to perform only target and parallelismal biopsies in the context of the prostate cancer diagnosis. But if you read all the full text of the guidelines, and if you are considering to make focal treatment, they recommend to perform systematic biopsies. So with this study, we reveal 700 biopsies, excluding high-risk features for patients that will not be able to focal treatment, in order to assess the relevance of contralateral sampling in detection of clinical significant prostate cancer that could alter the eligibility for focal therapy. So you perform almost part of the biopsies are performing in the fusion target my systematic, and the others only systematic biopsies, with an overall detection rate of 87% of the patients. But if you look only for the contralateral findings, about 70% of patients have bilateral contralateral significant disease, and 2.5 of these patients have exclusive only contralateral disease. And in just one case, there is an incorrect MRI interpretation of the radiologist. So 1 in 5 of the patients, if you consider only or omitting the sampling of a contralateral lobes, probably will not be a good candidate for focal therapy. So the conclusion that could we avoid the contralateral biopsies in this setting of focal therapy? Probably not, if you consider that most important is the histological findings, not the MRI visibility.